what you think.
What about the issues of the world?
What kind of spice you wanna be?
Tell me where you wanna travel.
Do you believe in luxury?
What's your hidden passion?
What makes you so unique?
Conversations with Nicole. Conversations with Nicole. Conversations with Nicole. Conversations with Nicole.
Greetings, greetings, greetings. I am Nicole Everett, the host of Conversations with Nicole, a talk show based here in Tallahassee, Florida, focused on connecting the community through conversations. It is Wednesday, July 1st, 2020. Gosh, the second half of 2020. And it's what I call What Women Want Wednesday. What Women Want Wednesday. So this is an interactive live, and I invite you to engage in conversation with me tonight. So if you will, start out by putting your city and state in the comments, so I can give a shout out and know who is tuning in with me tonight. Let me know who's tuning in tonight. So as I'm waiting on you all to put your comments in, I have some bad news. Oh, I say bad news. My guest had an emergency come up and will not be joining us tonight. However, she sends her regards and her regrets, and we will have to get her rescheduled really soon. July is Minority Mental Health Awareness Month, and as a result, I am planning on having a Black or brown mental health practitioner on each show this month. So on Mondays and Wednesdays, 10 p.m., I'll be right here with a guest to talk about minority mental health, Black and brown lives and their mental health. So let me give a shout out. I see you, Holly. Thanks for tuning in from Tallahassee, Florida. Holly was on the show not long ago from the Kearney Center in their Home 2020 campaign. So check them out, the Kearney Center, which is our homeless shelter here in Tallahassee. I see you, Tia Nia. Good to see you. Greetings. Thanks for tuning in. Also here in Tallahassee. And Chef Shaq, who's been on the show several times. Thanks for tuning in, my sister. Hope you're doing well. It's been a minute since I've seen you. So in lieu of a guest, I still want to talk about mental health, and particularly Black mental health, especially around, with everything that's been going on from COVID to protests to, just everything that's been going on. Black folks tend to not seek out counselors and therapists. Historically, I don't think we have sought the assistance of counselors, therapists, psychologists, psychiatrists for a few reasons. But I want to hear from you. I want to first know what you think good mental health looks like. What you think good mental health looks like in terms of if it's balance, if it's harmony in your life and all aspects of your life. What do you believe good mental health looks like? In the comments, let me know. While I'm waiting on you to do that, I want to read you some information that NAMI, I don't know if you all have heard of NAMI, but it's the National Alliance on Mental Illness. It's a national organization, but they have state organizations as well as local chapters. And our local chapter is headed up by Nancy O'Hara, and she might be on here tonight. And she and I both are on the Mental Health Council of the Big Bend, which primarily is looking at serving the Frenchtown Southside communities giving them access to or information about mental health services and hopefully providing greater access to those communities specifically. All right. So I see Shaq. She said peace. Peace is what good mental health looks like. I would absolutely agree with that. Peace is very important for your good mental health. So let me go back to NAMI. So some of the barriers that they list to mental health care are socioeconomic disparities, and that the statistics talk about 11.5% of Black adults in the U.S. have no form of health insurance. And African Americans, like other communities of color, are more likely to experience socioeconomic disparities, such as exclusion from health, educational, social, and economic resources. So that is one of the barriers to mental health care. One of the others is stigma. Stigma around mental health conditions is prevalent in society. And for a number of Black communities, discussing mental health can be a difficult subject. It talks about African Americans believe that a mental health condition is a personal sign of weakness, a personal sign of weakness. So the stigma acts as a deterrent because people feel like, I don't know if black folks in particular feel like if there's something wrong with my mind, I'm not strong. And I actually thought about this today because I talked to a couple of mental health practitioners in trying to set up schedules for them to come be on the show later on in the month. But that whole being vulnerable, showing a sign of weakness is huge, and I think that's something that we really need to let go. We need to let go of that whole, if I have a mental health issue, I'm weak or I'm not strong, or I'm not sure. I really don't. I'm kind of perplexed as I kind of talk this through with you all, but we need to let that one go. Let's see. It also talks about faith and spirituality helping in the recovery process. If you do utilize health mental health practitioners. Provider bias was also something that was listed as a barrier. Provider bias and inequality of care. And it talks about how African Americans have been and continue to be negatively affected by prejudice and discrimination in the healthcare system. Now, I recently did a post where I went on a walk, the Unity Walk, and it was with some of the healthcare practitioners. And I actually, when we wound up at our ending place, talked to one of the white male physicians and asked him, why was he here? Why was he at this Unity Walk? He wasn't Black. What difference did it make to him? And he said, it made a lot of difference to him. But I asked him specifically if there were some racial disparities within the healthcare system. And he said, absolutely. And he talked specifically about how, even though he had gone to medical school 30 years ago, some of the schools of thought back then were that Black people could tolerate more pain than white people could. And I was just kind of blown away by that. That was the first time I ever heard anything like that. But, that is one of those mindsets or thoughts that perpetuates that whole provider bias. It says conscious or unconscious bias from providers and lack of cultural competency can result in misdiagnosis, inadequate treatment, and mistrust of mental health professionals. And I think that actually is across the board with just health professionals, period. I know that I have some relatives that especially some of my older relatives that do not trust doctors. They think that they're going to do them some harm. So, there's a lot of, how do I want to say? There's a lot of bridge building that needs to be done in that area. Yes. All right. So let me pause from the NAMI data and look at some of your comments. All right. Okay. So Javon, greetings. Javon is in Atlanta. She said, definitely balance. For all the stress, we have to release a percentage of that stress and replace it with personal peace. Yes. All right. Holly said, loving all of myself. Yes, love it. All right. I see you, Renee. Thanks for watching. All right. Shaq said, was just speaking with family member about mental health and NAMI. Yes. So NAMI locally has some programming that's going to be going on this month. I'll try to get some information on the page as it relates to that. Tia said mental health looks like people who bounce back from hard times. They don't over medicate with drugs, alcohol, or other vices. I think we have used friends to get through hard times. Agreed. So, Tia, I think what your comment about over medicating is very, very true. I think that we can medicate using a number of different things. It doesn't necessarily have to be drugs or alcohol, but for some it could be food. For some it could be sex. For some it could be gambling. So, we tend to have kind of extreme behaviors when we're trying to cope with things as opposed to balancing. I think the kind of the new jack word for bouncing back is resilience. Bouncing back from hard times. How resilient are you? So, very good point. Thank you for sharing that. All right. Who else do we have on here? Denise, I see you. All right. Patrick said, Black mental health matters. Indeed, my brother. Thanks for watching. All right. Shake said, easier said than done. It is a deep thing. Yes, it is. All right. And she said, being demonized by believers is hard to overcome. All right. All right. Deborah said, so many African American families have someone in their family with a mental health issue. I was going to touch on that because that is very, very true. I believe that until recently, the church was a barrier to mental health and contributed to the myth that issues like depression as an indicator of weakness of spirit and mind. So Deborah, also very, very accurate on that. I think that that was actually going to be another point that I brought up, was that, many African Americans, I believe, of the Christian faith, believe that they can either pray the situation away, or, like you said, they see a mental illness or poor mental health as an indicator of weakness. And maybe that's where that came from the, that may be some of the origin of this whole idea that if you have a mental illness, if you're depressed, if you're stressed, that you're weak, and that you're you have a weak mind. So that's again truly something to we need to eliminate that mindset. All right, Shaq said many celebrated white physicians have abused Black people because of that lie that we can take more pain. Yes. Yeah. I'm kind of blown away by that, but I'm hearing it a couple of times, like recently. So clearly that must be something that is being perpetuated within the healthcare mind struck. So I see Alonza, mental health topic. Good to see you. Thanks for being on here. And I see you, Juanito. Thanks for being on here, my brother. Appreciate you. Candace said, thanks for the topic. It's much needed. My pleasure. My pleasure. So let's get back to NAMI. So Let's see. So they actually list a whole bunch of mental health resources, but one of the things that I wanted to talk about, they talk about how to seek competent care. How to seek competent care. And they first recommend going directly to your primary care doctor and starting there. Get a mental health assessment. How many of you all even knew that that was a thing, that you could get a mental health assessment? Did y'all know that? You can get a mental health assessment. So do that. Take advantage of that. And then get a referral to a mental health professional. Get a referral to a mental health professional, a counselor, a therapist, a psychologist, a psychiatrist. You know, go see these folks so that you can talk through what's going on with you. When meeting with a provider, it can be helpful to ask questions to get a sense of their level of cultural sensitivity. So, one of the things that the Mental Health Council did was we came up with a list of Black and Brown mental health practitioners here in the Big Bend, primarily in Tallahassee. And that list has been posted by myself on the Conversations with Nicole Facebook page, by NAMI Tallahassee, their Facebook page, by Whole Child Leon, their Facebook page. So I will be putting that list out continually throughout the month because, you know, if we are more comfortable meeting with people who look like us, who have the cultural competencies and have gone through similar experiences, then why not utilize those folks? So, you know, ask certain questions. If you can't get a Black or Brown counselor or therapist, ask culturally competent questions to see if they're going to be sensitive to what your needs are. And then seek, you know, seek practitioners that may have a cultural background that's similar. So maybe they aren't an American, an African American in terms of being born here, but maybe they are from the Caribbean. You know, I'm from Miami. There are a number of Caribbean physicians down there that, you know, are from, you know, the Caribbean islands. So they, again, may have some cultural competencies because of that. And then ask yourself certain questions when you meet with these folks. Do you feel like the provider communicates effectively with you? Is your provider willing to integrate your beliefs and practices and identify and cultural background into the treatment plan? Will they take that into consideration? Do you feel like you're treated with respect and dignity? And I think that probably more than anything is one of the huge contributing factors. You know, folks may feel like the doctor or the nurse doesn't have a good bedside manner. You know, they don't treat them with respect, and that's a problem. And do you feel like your provider understands and relates with you well? You know, again, oftentimes if the provider doesn't look like you or come from a similar background, then probably not. So, relationship communication are very, very important in identifying a provider to offer you mental health care. So, you know, again, all of this actually can be found on the NAMI website, which is nami.org. And they have a section specifically for Blacks and African Americans. That's what it's titled. So check it out and use it as a resource because we need to definitely sorry, I'm thinking and talking at the same time. We need to definitely get mental health services. So mental illness is an illness just like heart disease or cancer or, Diabetes, it needs to be treated as an illness and not just the blues, because you might be stressed, you might be depressed, you might be manically depressed. Sometimes it may take therapy from the standpoint of talking to somebody. Sometimes it might take medicine. Sometimes there are some things that you may be able to do by getting enough rest or exercising or changing your diet or drinking lots of water. Those things can also contribute to your good mental health. So definitely want to encourage you all in that vein. Definitely want to encourage you. All right, Alonzo said, prayer works, but for so long we've been taught to only pray, neglecting to do the work necessary to break free. Faith without works is dead. Amen. So Alonzo has been on the live here with me. He is a counselor as well as a pastor. So he's saying a combination of the two, which I totally agree. You got to put in the work. And, we actually talked about that when he was on the show, that, you need to know yourself, and, you need to, the things about yourself that may not be serving you well, you need to eliminate. And that's a process. So, you need to go back and figure out why it is that you do some of the things you do. A lot of what we do is based on our experiences from childhood. I don't know if you all are familiar with adverse childhood experiences. They also are called ACEs. That's what the acronym ACE stands for, adverse childhood experiences. And if you really study that thing, you would find out that there are a number of things that we do as adults that stem from our childhood. Some of them are not adverse, but the adverse things can typically make you decide to maybe go way way away from whatever that experience was that was adverse, or maybe you've developed an affinity for whatever the adverse thing was, and you continue to perpetuate it because that's all you know. So ACEs are real. There's actually an ACE test. I'm gonna see if I can try to get somebody on here to talk about ACEs. So y'all be on the lookout for that. But in the meantime, check it out and see what you can find out about adverse childhood experiences. All right. So Alonzo said, be just as proactive about your mental health just as you are about your physical health. So I concur. All right. Johnny said, is healthcare affordable? I'm not sure, Johnny. Expound on that question for me when you say, is healthcare affordable? What do you mean by that? I think it depends on whether or not you have insurance or not. I think more, in addition to affordability, accessibility is a major contributing factor to healthcare. So if you don't have transportation, or maybe you live in a rural area and your healthcare provider is many, many miles away from where you are, then that might be an issue. Or if the hospital is in the next county over, then that might be a problem. So I think affordability and accessibility are two major contributing factors to healthcare. All right. Alonzo said, I am a certified pastoral counselor. If anyone is interested. Black-owned counseling and coaching ministry. Yes, Alonzo. So please go ahead and put your information in the chat, in the comments for us, in terms of how people can reach out to you. All right. I see Tyrone, my homeboy Tyrone says, blessings. Thanks for being on here. And Barb Moore Austin, she says, hello, everyone. Thank you, Barb, for being here. All right. Tia said, there are group services. Overcomers Anonymous is free. Okay. Not familiar with that one, Tia. If you have any additional information on it, please put it in the comments so we can have that as a resource. So NAMI also offers group services. I actually just sent a flyer for local services here in Tallahassee to a veteran friend of mine. But that is something that is available. NAMI does not only services for and counseling groups in particular, but for folks that suffer with mental illness or have suffered with mental illness, but also their loved ones. So they have support groups for their loved ones. So this one that I sent to him was a PTSD support group. And the one here in Tallahassee, it's a free 8-session program for adults and mental health conditions to learn more and to recover. So they also give some recovery tips as well. So they have 800 helplines. I'll put those numbers in at the end so that you all can have access to that as well. So there are a number of support groups. There are a number of helplines out there. So please, 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 to the extent that you yourself need services or support, or know somebody that needs services and support, by all means, share the information so that they can get the support and the services that they need. All right. Jenelle Robinson, Dr. Jenelle is on here. She says, "Hey, Nicole, good to see you, sis. Hope you are well." So Dr. Jenelle has been on the show before. She teaches nutrition over at the Florida Agricultural and Mechanical University, but she also has been doing some live shows with Gian Jones, which I think they come on tomorrow, if I'm not mistaken, about transformational, what is it? Help me out, Jenelle, because I'm messing it up right now. I'm going to look it up right now on, I don't see it, on IG. Here it is. Here it is. The Transformation Place is what they call it. So she and Gian kind of talk about how Dr. Jenelle is doing with her transformation, with her anxiety, and she talks about mastering her anxiety. So I really enjoy their interaction. Okay, she put it in the thank you. Put it in the comments for me. So IG Live Thursday 8:30 p.m. and that's on It's Gian Jones's IG, as well as Jenelle Robinson on her IG. So it's mastering anxiety. I think is great because I think we all suffer from or have experienced anxiety from time to time, and sometimes it can definitely get the best of us. So, Gian is such a smooth, kind of even keel life coach. And I don't know if life coach is what she claims, but she does a great job with navigating and showing how she navigates through life. So I'm putting that out there. All right, let me go back. Alonzo put his information there, so check that out in the comments. Tia said they meet at Clare Methodist and other places prior to COVID. They deal with different types of addictions. Okay, thank you for sharing that. Janelle said, "I'd like to know thoughts of others concerning using mental health services that are not necessarily in alignment with your religious preferences. I've seen more significant progress with non-Christian therapists than I have with Christian therapists. What might be the differences in approaches that may make one therapist a more appropriate fit than another?" That's a very good question. I'm going to tell you, the thought that comes to my mind initially is judgment. I think that a lot of times Christians can be very condemning and, not open to maybe some other techniques. But that's just my thought. But I would love to hear from some of the other viewers if you all have had an experience with a Christian therapist versus a non-Christian therapist, and what do you think might be the differences in approach that may make one more appropriate fit? Yeah. What do y'all think? What do y'all think? Anybody that's utilized both, let us know. All right, Barb said Medicare also offers behavior health sessions. Okay, that is also great to know. I bet you a lot of people don't really know that because they probably don't push that. It's almost as if those types of services are kind of just lurking in the back. And what I actually have found, to be honest with you all, since serving on the mental health council, is that a number of these primary care physicians are kind of uncomfortable talking about mental health because it's not their area of expertise. That's a whole nother mindset. So I think that in their uncomfortability with the topic, with the subject, they probably, won't recommend that. But I think that mental health assessment may help bring some of that out. So definitely, utilize that because that is something that you can have access to, and that can lead to that referral that you may need for those behavioral health sessions. All right, Jenelle said using scriptures for everything when I grew up in the church, and know and have tried all of them in some form. Let me read that again. Using scriptures for everything when I grew up in the church, and know and have tried all of them in some form. Gotcha. Yeah. Again, I think I'm of the mindset of Alonzo when he talked about having a combination of both. Um, I think faith does play a role, but uh, and I don't want to say this sound like you shouldn't believe, but as he said, faith without works is dead. So definitely believe, but God also gave us um, doctors and therapists and counselors and healthcare, mental health practitioners. So utilize them. That's what they're here for. All right. Gian, she said, love to hear. Thank you, Gian. All right. So that made it more difficult. All right. So you saying that made it more difficult. The using the scriptures for everything when you grew up in the church. So I can imagine that being the case, especially, because a lot of times it seems like the interpretation of the scripture is very black and white. Like there's no gray. There's, it's pretty absolute. So, I can see how that could be a challenge. But, we know that there are some things that, well, with the Bible, you have to take it into context, right? Understanding who the people are that were involved at the time, what was going on at the time. So sometimes we can be so very literal with the word that we put ourselves in bondage, I think, sometimes. So that's just my 2 cents on it. All right. Barb said Medicare also offers 22 sessions per year of obesity counseling, FYI. Interesting. Okay, that's good to know as well. So I know Dr. Jenelle will probably jump all on that because I think last week's live we were talking about what was that we were talking about, and you kept saying diet, Dr. Jenelle. Let me know what it was. I can't remember. All right. Tia said, I think Christian services are trying to deal with mind, body, and spirit. I always interview people, but having a moral base helps. Okay. Yes. You know, we can't get away from morality. I think that's the foundation of who we all are. So I agree. Alonzo said the fit is based on the preference of the individual. Christian counselors take the same approach to therapy as the mainstream therapists, but also incorporate prayer, faith, and scripture. Okay. Seems like they should, Alonzo. I think that again, sometimes that could be a fine line. I think sometimes that could be a fine line. So Alonzo further said biblical counselors do not incorporate the main therapeutic approaches, but stick solely to scripture in their practice. Okay. So I have not been to a Christian counselor. Um, so I don't really have anything to compare it to. I was just giving my thoughts and opinions about it. All right. Jenelle said eating healthy is a form of activism. It was activism. Yes, we were talking about the new age activism. So she mentioned that eating healthy is a form of activism. So that may line right up with Barb's comment about these 22 sessions per year of obesity counseling that folks can take advantage of. All right, cool. All right, so let's see. Tia said, good ones do. I have met some great counselors. All right, well, that's great. That's great. That's great. That's great. Yeah, like I said, I'm going to put that list out again, and we are expanding that list. So if there are folks that you all know of that aren't on the list that we need to add to the list, by all means, let us know. We are, just trying to give folks resources and, the knowledge. Maybe they don't know that there are African American counselors and therapists that they can use here in Tallahassee. I'm gonna be honest with you. When that list came out, I was shocked. I really didn't know there were as many here um, as were listed. And when I put the list out, I found out that there are actually really many more. So, because a number of people reached out and said, hey, you forgot this person and you didn't have this person. So, please let us know if there are some folks that we need to add to that list because we will gladly do so. All right, Alonzo said, also depends on where they've received their training. So, talking about the counselors and therapists, so agreed on that as well. So, it sounds like I have, of you all who are commenting, you've had some experiences with counselors, or you are a counselor, like in the case of Alonzo, specifically with women. I'm curious as to, are there some sensitivities with women in counseling that we should be aware of? Maybe women are a bit more emotional. Um, Maybe they may be more foretelling, with their life story or the information. So, are there any special or any characteristics of women patients that come in that you think um, you know we should be mindful of? Anybody who is a counselor or talks to women, women patients, or you deal with women in particular, any specialties as it relates to women, because this is what Women Want Wednesday, right? This is what Women Want Wednesday, and we want to know what the women want, what the women need, especially as it relates to having good mental health. Good mental health. Again, this is Conversations with Nicole for anybody that's just tuning in, and this is What Women Want Wednesday, and we're talking about minority mental health. Minority mental health. July is Minority Mental Health Awareness Month, and for the rest of the month, hopefully, prayerfully, we will have Black and Brown mental health practitioners on the live with me and with you to discuss some topics and also give some solutions as it relates to those various topics. I'll tell you one of the topics that one of my guests pulled up as a potential for our conversation, pull it up, is boys and men of color healing from systemic and interpersonal trauma. Boys and men of color healing from systemic and interpersonal trauma. There was actually a whole panel on this topic, which I thought was really deep. But yeah, they talk about the role of racial and historical trauma within the experience of interpersonal violence and trauma. Um, I've not heard so much about trauma before I got involved with the mental health council, but it's a real thing. It's a real thing, and trauma shows up in a few different forms. Um, you know, I guess growing up, when I heard the word trauma, I always thought of like the emergency room, and you know, not to take away from the other forms of trauma, but I thought, somebody was bleeding severely, or you know, they were really mashed up really bad, broken bones, or a head injury, or something like that. But trauma can take on some other forms that, and I'm trying to find. I actually sent this list to someone the other day. Um, Hold on, give me one moment. Trauma. It talks about there being three main types of trauma: acute, chronic, or complex. Acute trauma results from a single incident. Chronic trauma is repeated and prolonged, such as domestic violence or abuse. And complex trauma is exposure to varied and multiple traumatic events, often of an invasive and interpersonal nature. So there are some levels to trauma. So that was kind of news to me. Acute, chronic, and complex trauma. Acute, chronic, and complex trauma. So again, hopefully we'll get a practitioner on here to talk more about that. All right, so Alonza, who is our counselor on here, is chiming in. All right, so he said that when he said, I found that it is easier to counsel women than men. Most women are capable of making their issues clearer than men. Interesting. Okay. All right. And each case depends on the mental state of the client when they come in. I've also counseled women who were very deeply traumatized, and it was very difficult getting through the earlier phases of the counseling process. Okay. Yeah, I can imagine that to be difficult. I had a conversation with a practitioner today about vulnerability, and how easy it is, or not easy, how difficult it is rather, for adults sometimes to communicate. This particular practitioner deals with youth and adults, and talked about how the youth really kind of give her the information raw, and don't have a problem talking about whatever it is going on with them. So I think sometimes as adults, we kind of have hangups, and probably, maybe we don't want to, again, appear vulnerable. We don't want to be judged or be belittled, or whatever the case may be. But, if this is somebody that have vetted to the extent that you can vet it, you feel like there's a pretty good vibe, and I use that word vibe, but you feel comfortable talking with them, then you need to go ahead and open up and share, because that's going to lead to hopefully your healing. So excuse me. All right, Seta. Hey there, Seta. She said much of what's excuse me, I don't have my water bottle. Much of what's going on seems to fall in the category of complex trauma. Excuse me, y'all. Our men are being affected by the constant replay of young men dying for no reason. Ooh, that's a good one. That's a very good one. I think that is very true. And we probably don't recognize that So I definitely need to write that one down for us to consider for future conversation, especially on Man Up Monday. So thank you for bringing it up, Seta. All right. Alonzo said, I specialize in youth and young adults, but I counsel adults as well. Okay. Thank you, Alonzo. Appreciate that. So yeah, we got a lot to talk about, y'all. We got a lot. So I just wanted to kind of throw this out here. Since my guest was not able to make it tonight. And we just wanted to kick off the month with an initial conversation on mental health, especially for people of color, Black and brown folks. And we're here in America, so that's primarily our experience. All right, we got Janita on here. She said, I'm not sure if it is a matter of gender. I think if a client has had adverse childhood experiences, it can be difficult to break into the core of the individual. The individual has walked around with the issue and has not addressed it, are living in survival mode. This is the client perspective. Agreed, agreed, agreed. So you're right. I think that it depends. It does depend on that. I was just curious. Alonzo gave some of his experience as a counselor. He said, about women um, seeming to be a little bit more capable of making their issue clear. And, he also just said it depends on their mental state and how deeply they've been traumatized. So thank you for reiterating that point, Janita. Appreciate it. So I'm going to wrap this up, y'all. Again, I did not want to stay here long. I just wanted to throw this topic out here. We will be talking about this for the entire month of July. So please engage in more of this conversation. Keep this conversation going. I see Miss Lori on here. I just met Lori over the weekend at one of my LT classmates' homes. Hey, Lori, she said, thanks, Nicole. I believe people who study trauma are also beginning to look at generational trauma and trauma being passed on through families. Yes. So I have read up on that recently as well. Thank you for mentioning that. So I will see if some of the practitioners can address that issue too. So again, appreciate you mentioning that. All right, so Seta said the fact also that our Black and brown men do not talk to each other, let alone go to counseling, is a great problem, period. Their issues are usually internalized and not addressed. It's worth talking about more. So we will dive in. I've done some of that work here on the lives on Monday with Man Up Monday, and there have been some really what appear to be breakthroughs in terms of men sharing on here, which is great because I want this to be a safe space. I mean, I know it's social media, and I know that you probably don't sometimes feel comfortable being vulnerable on here or sharing on here, but you just never know how you share your story or the story of someone who you may have interacted with or encountered with may help somebody else. So I encourage it. I welcome it, and I hope that we will have some great interaction where people can, you know, get get to the core of what's going on with them, and hopefully I call it dealing and healing. So dealing with the past and healing from the past. But you got to deal before you can heal. So a lot of that is peeling back those layers of that onion. For instance, I use that as an example in getting to that core, getting to the root cause of what's going on, and then healing from it, coming to terms with it and healing from it. So again, just wanted to get the month kicked off with the beginning of the conversation, but we have much more to come, and you all have done a great job tonight, giving some ideas and um, sharing. So thank you so much. I really appreciate you all being on here. And I hope you all have a great rest of the week, a great holiday weekend. Y'all be safe out there. You know, here in Florida, we have shut some things down after opening them back up. So be careful out there. Stay home as much as possible and social distance as much as possible. If you have any suggestions for any future shows, topics, guests, let me know. Message me, text me, call me, let me know. Because I definitely want to, you know, cover the things that you all want to hear about or want to talk about. So, and if you have not subscribed to the Conversations with Nicole YouTube channel, by all means, please do so. The lives that are on here will also be on the YouTube channel. So you don't have to just come to Facebook. You can get them there and share them from there as well. I've actually shared some of the links with some folks that I know that are not on Facebook. So utilize that resource as well to keep the conversation going. So again, thank y'all, thank y'all, thank y'all. I'm going to get some water because my throat is super dry. I don't know what I was thinking about not having my cup right here with me tonight, especially talking the whole time. But I again appreciate y'all and hope you have a really good evening. And I'll see y'all next time, next week. Conversations with Nicole.